morning. I actually graduated. I'm an assistant professor now. Very exciting. Thank you. So my name's Kayla Karvonen. I'm an assistant professor at the University of California, San Francisco. I'm in the Division of Neonatology, so I'm a neonatologist and a researcher. And today we're talking about why we must get comfortable talking about racism in healthcare settings. So I know that this is an uncomfortable topic. I know it's taboo, it's dreaded, and that's a shared experience for all of us. It's uncomfortable talking about racism in the healthcare setting. And I think that's a very natural response. There's a long history that racism has put forward. And this history is full of pain and suffering and blame and discomfort. And so that's a shared experience that we all have. But I think that's the first reason why we have to talk about racism in healthcare. Because when racism is uncomfortable and talking about racism is uncomfortable, we just avoid talking about it entirely. And we can't afford to avoid talking about a topic that's this important. So first I want to say thank you for engaging in an uncomfortable conversation today. So let's start with a thought exercise. So I'm borrowing this from Dr. Tamara Lewis. She's a neonatologist and researcher in Toronto at Sick Kids Hospital. So there's a lot of healthcare workers here. I want you all to imagine going into the hospital that you work in. You're walking through the front doors, going up to the unit that you work in. And you pass by doctors and nurses in the hallway, and you notice that they're Black and brown folks. You see C-suite executives, you know that they're hospital leadership because they're wearing business suits in the hospital, and they're also people of color. And come to think of it, when you walked through that front door, you already greeted the front desk staff, and you noticed that they were white. You greeted the cafeteria staff who were white, the security staff, and the hospitality staff, and they were all white. So let's just sit with that scenario for just a second. This thought exercise can feel so unfamiliar or different or unusual because it's different than the status quo that many of us walk into as healthcare providers in our hospital, where many of the nurses and doctors and hospital leadership are white, and the people who work blue-collar jobs or in the service industry are not. This thought exercise is the second reason why we have to talk about racism in healthcare settings, because racism in some ways has become the status quo. Racism and its downstream effects, like a lack of workforce diversity or job inequality, can start to feel normal. And we have to recognize the water that we're swimming in. So I hope to drive home these main take-home points today. What racism is and how it works. That racism is relevant to you as someone who's residing in America today. That racism is impacting NICU patients and their families. And that talking about racism is the very first step in addressing it. So Dr. Camara Phyllis-Jones is an anti-racism scholar and activist. So she's defined racism as a system of structuring opportunity and assigning value based off of the social interpretation of how one looks or one's race and ethnicity. And that unfairly disadvantages some individuals and communities and unfairly advantages other individuals and communities. And importantly, it saps the strength of our whole society through a waste of human resources. So how does racism work, and what does that system look like? Well, racism is a system, so there's different types of racism or levels of racism, and all of them have to be addressed in order to achieve health equity. Health equity is a state where everyone has the opportunity to experience health and longevity. So the different types of racism: internalized racism. So this is the result of all of us individuals living in a society where we experience racism. It's internalizing or accepting positive or negative messages about our intrinsic self-worth because of our race. The most traditional type of racism that you probably had in mind when we first started this talk is interpersonal racism. This is racism that's prejudice or discrimination about our abilities, our motives, our intentions because of our race. And institutional racism is the type of racism that's embedded in our institution. So we're going to talk a lot about healthcare today, but it doesn't matter what institution you consider, the criminal justice system, the banking system, the educational system. Racism exists in all of these spaces. And each institution has laws, practices, policies, procedures, just the way that we do things that can perpetuate racism and create an unequal distribution of resources and opportunities of a society by a racial group. And then finally, structural racism is the totality of ways in which racial discrimination is fostered in our society. So these ways are mutually reinforcing, and they include these housing, education, employment, media, etc. These patterns and practices in turn reinforce one another, reinforce discriminatory beliefs, values, and a distribution of resources, according to Zinzi Bailey, who's a social epidemiologist. So structural racism is a major influence in our society today. The air that we breathe, the food that we eat, where we live, who gets access to resources and who doesn't. All of these factors are social drivers of health, and they impact our health and well-being. So put simply, racism impacts our health. And of all of the forms of inequality, injustice in healthcare is the most shocking and inhumane. So this should matter to us as Americans, as people who are living or working in America today. All of these factors should matter to us. It matters to our friends, our family members, our community. When they experience inhumane and unethical treatment, it matters. So as someone who's working and living in America today, racism is relevant to you. As a healthcare worker working in the neonatal field, it's also relevant to you. It's impacting NICU patients and their families. And talking about racism is the first step in addressing it. So in almost every talk that I give, I have slides and slides and slides of data, of bar graphs, of statistics, of racial inequities in the NICU. It doesn't matter whether you're looking at maternal or child health, racism exists in every corner of those spaces. Whether you're considering health conditions of a pregnant person, including death, whether you're considering preterm status or consequences related to prematurity, rehospitalization rates, emergency room visits, treatment of families, the quality of care that we deliver in the hospital. Racial inequities exist and persist in all of these spaces. But I'm not going to show you those bar graphs and statistics and data today, because as healthcare workers working in this field, I'm certain that you've already seen these. And I think the most important thing to remember is that behind these bar graphs and statistics are people who are experiencing adverse outcomes. So you may or may not have grown up talking about racism at the dinner table as part of your general conversation. But I certainly did. And so many of us who are racially marginalized talk about this in the regular, as a part of our normal conversation in our homes. And that's because it's a part of our day-to-day experience. It's the racial slur that you were called yesterday on the bus. It's the microaggression that your coworker said that they're blissfully unaware of a couple of days ago. It's last week when you went to the doctor and you were totally dismissed. It's last month when you were racially profiled by the police or stereotyped at the grocery store. It's recent memory. It's everyday life, it's family lore, it's stories that are passed on from generation to generation. Bottom line, racism is our regular conversation at home, and we have to be prepared to talk about it when it comes up at work. And not only is it a conversation at home in the privacy of our own homes, but it's in our public spaces and the mainstream news. It's on your phone, it's on the TV. So I'd like to ask you, what are you going to say when a parent of a patient that you're taking care of brings up one of these news stories? Or more importantly, what are you going to say when they disclose that they can relate to it? Black Americans expect to face racism in the doctor's office. Patients of color more often brace for unfair treatment in healthcare. Half of US healthcare workers say they've witnessed racism against patients. Childbirth is deadlier for Black families. What Serena Williams' scary childbirth story says about the medical treatment of Black women. We have to be prepared to talk about racism in healthcare. We can't be prepared if we're avoiding the topic entirely. So there are a number of studies that have come out that have talked about families experiencing racism in the NICU. This is one of them. This is a study that was published in Pediatrics by Dr. Witt and her colleagues, where Black families were interviewed about their experiences with racism at Washington University in St. Louis. Dr. Witt and her colleagues had two main take-home points that I want to talk about today. One is that racism exists in the NICU. And she gives you permission that you can look for it and talk about it in yours. And I think sometimes that's what we need, is permission to look for and talk about racism, because it's so hard and easy to avoid. The second point that she makes is that racism is not an inevitability. You can think of it as a preventable harm. So you can look for it, you can talk about it, you can prevent it, and you can address it. So before you say that that sounds like a St. Louis problem or an individual NICU's problem, I want you to consider that there are no shortage of accounts of racism in the NICU. Whether you're talking about Missouri or Texas or California, there are no shortage of these accounts. It doesn't matter what state or city or hospital or unit that you look in, racism is impacting families. Because remember, racism is a system. It's ubiquitous. It's in the water that we're swimming in. It's the status quo in some ways, and none of us are immune to it. It's up to us to have the courage to ask how it's showing up in our immediate area, because it is. So I know that it's hard and difficult to accept that racism is happening in a place that we care so deeply about. I truly believe that healthcare workers go into healthcare because we want to help people. We want to heal people. We are compassionate about others. That's why we went into healthcare in the first place. And we have to recognize that racism is a ubiquitous system that we're all exposed to, no matter who we are. It's the water that we're swimming in. In our study that we conducted in our hospital, asking families about racism in the NICU, one of our key findings was that care and harm coexist together. Families have so many experiences during their hospital stay. In our study, they described countless stories of excellent, compassionate, above and beyond care. And they've told us experiences where they were harmed, dismissed, or disrespected. These two things go together. Both care and harm coexist. And it doesn't have to be your fault to be your responsibility. So we have to name racism when we see it. I believe many people and healthcare units are at this very first step. You're not alone. We all have the power to name racism, to ask how is it operating here, and organize and strategize to act. This is a framework by Dr. Camera Phyllis-Jones. You may be at step 1 and you're looking for more information about step 2 or step 3. Dr. Animesh Sabnis, a neonatologist and director of health equity at UCLA, and I have written a practical guide and application for how you can do this in your healthcare unit. So look for that coming out soon in Neo Reviews. So we have to address the elephant in the room when it decides to walk in. Ignoring the elephant will not make the problem go away. The problem will become worse if we do not address the elephant. The only way to get out of this problem is by acknowledging that it exists in the first place. And when we avoid talking about racism, we perpetuate the status quo. In conclusion, all people want the same thing, health and longevity for themselves and their community. Racism is simply in the way, and we have to acknowledge, confront, and dismantle racism to achieve health equity. Thank you.